Butler, Wabash, and DePaul students head back to class today. IU, Purdue, Butler, all of them in class. Top of mind for students, maybe this will surprise you, mental health. That is according to a new survey of college students. When asked what their top concern was as this fall semester begins, they said, it's my mental health. Clinical psychologist Dr. Danielle Henderson with IU Health is joining us live now to talk about this and to answer some questions. And Doctor, hey, good morning. First of all, I want to just dive into this new study because it's used 8 years of data, and it shows mental health of students is actually on the decline. Can you kind of dive into this and tell us what you want us to know first about this study and what it found?
Sure. Well, it found, as you mentioned, that over the 8 years that they studied and surveyed, mental health was on the decline. In 2020 and 2021, over 60% of students met criteria for one or more mental health problems, which was almost a 50% increase from 2013. And I think it's also helpful to note that different groups have been impacted by mental health differently. So this study found American Indian or Alaskan Native students experienced the largest decreases or increases in depression, anxiety, suicidal ideation, and then also found some interesting results for students who are Asian, Black, Latinx.
What did you find specifically then about those groups that you just mentioned? Was it slightly a little bit better, or still just something different about those groups as well?
So what I can remember is students of color actually had the lowest rates of mental health service utilization. So it's important to note that students of color may be experiencing mental health concerns, but may not be utilizing mental health resources. So again, just something to keep in mind as we think about our college-age students.
Yeah, when we're hearing kind of this broad, I don't want to say thought here that the number one thing on their mind is the mental health issues. What do you think that really means? I mean, is it more than just feeling, is it the feeling of anxiety? It is the depression? It's all of the things combined with mental health, or was there anything, one or two things that really stood out above the rest of what our students are dealing with right now? It's kind of, you feel like you got to know what the real problem is before you can help.
Yes, no, I mean, I think on one hand, with social media, people have maybe become more aware of mental health and mental health concerns and what, specific symptoms look like for certain diagnoses. So I think in some ways this may be helpful. People may be learning more about what might be going on with them, getting reminders again through social media to check in on themselves. And so I think then maybe people have been noticing some increased anxiety, depression. We also have to realize that some of these students were definitely impacted by the pandemic, which is a huge stressor, has been a huge stressor for a lot of people. So a lot of concerns going into school for them right now.
Let's break down what we can do, starting with the students themselves. Different groups, like as you mentioned, maybe more are seeking help or not seeking help. What can maybe we do, as parents do too, to kind of encourage our kids or to kind of make sure that they are doing okay?
Sure, no. So I would encourage for everybody remembering that mental health resources are available to you. So thinking about particularly if you are a college student or at a university, there are mental health or counseling resources available to you on the campus. So even if you don't think you need it right now or you're not quite sure, I think it's always helpful to know what are those resources available to me, where are they located, how would I go about getting an appointment if I needed to, just in case you or someone you love may be in need. I also think, finding some sort of support. I know it can be really hard and scary when you're going to college, but finding some sort of support through your friends, through activities that you're involved in, spiritual or faith networks. And then I think with parents, having conversations about all of this, becoming comfortable with discussing mental health with their college-age student.
Well, we hear more than ever, connections. Connecting with people, having community is one of, if not the most important thing, and we're doing less and less of that and divided, more and more. So thank you for being here, and we're out of time, but I really appreciate at least the discussion and, talking about it here, and then we can inspire people maybe to talk with their kids, or the kids watching can talk with their friends. Good to see you.
Thank you.
You're welcome.